May adlaw na tong tanan. Is your hand and fingers curled up into a fist? And if you want to open it up, then you need to watch this video. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. A few months or weeks after you had a stroke, your arm will become spastic, meaning it will feel tight and difficult to move. So it won't be flaccid anymore. Your elbow will be bent and tight like that, or straight and tight and difficult to bend. But more than likely, your hand and your fingers will curl up and turn into a fist like this, right? So it is important for you to ask your occupational therapist or physical therapist to give you exercises or stretches, management on how to open your hand back up and give you stretches to a neutral position. And on your own, you can also do this exercises and stretches in the comfort of your own home. Although the goal is to open up the hand, we need to mobilize the entire arm. But first, let me put on a sleeve so that you'll know which arm is the stroke arm, okay? Alright, so my stroke arm will be my left side, okay? The one with the sleeve. The first management will be to massage the chest muscle. So we're going to start from the midline, from the middle, and use your knuckles and go upwards towards your shoulder, alright? Our chest muscle when you have a stroke would be very, very tight, okay? So you just massage going upwards towards the shoulder for a minute or so until you feel that that muscle is relaxed already, okay? When you have a stroke, your shoulder will curl up like this, and that's because of your chest muscle, okay? So massage it like that for a minute, all right? And that is chest massage. The next exercise would be to open up the underarm, okay? We need to be able to stretch our shoulder towards flexion or going forward and up, okay? So we are going to just lean forward and back, cradle your arm if you don't have the table yet, cradle your stroke arm with your good hand, and you just lean forward and back, just like this, okay? So when you do that, you will see that your underarm opens up, right? So you are able to passively stretch that shoulder. You can also make use of the table, okay? So lean forward, go gentle, and then put that arm in front of you, and then lean back. Then come forward again. Lean back and forward, okay? So you just do this 10 times. Let's do this 10 times, all right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is gentle rocking to open up the underarm. Now let's try to relax our elbow. So if your elbow is bent like this, okay, and your hand and your fingers are curled up, right? You want to be able to straighten it out, okay? So the first one that you need to do is to brush this muscle right here to facilitate it, okay? Go a few times, 10 times, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now you will also notice that there will be a tendon here from a muscle that's very tight. So that will be your brachioradialis, right? So you are going to just grab that tight tendon, all right? So grab it and then go back and forth very gently. So like this, like you're playing it, okay? Just go back and forth very gently. Go slow, okay? Because that is very tight, okay? Now, if your arm is very straight and tight like that, you want to be able to bend it, right? So what you want to do is to brush the biceps muscle this time. So you go up 10 times, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then try to bend that elbow. It'll be easier. Try this. Don't swipe or don't brush your muscle and then bend that elbow. It will be more difficult. So brushing it a few times, 10 to 15 times, will help you be able to bend or move that particular joint easier, okay? So that is how you relax your elbow. Next one, we are going to do the forearm rolling. So you want to roll that forearm, okay? Because we want to have access to our hand and fingers. So I'll pretend like my hand and fingers are curled up, okay? It is very tight. It's difficult to get that forearm to face up or face down, okay? So you just be gentle and be patient, all right? Let's try to do 10, all right? And 1. Gently roll it down. 2. 3. 4. 5. 6. 7. 8. Use your entire hand. Okay? 9. And 10. And that is forearm rolling. The next one is going to facilitate the reflex of opening your hand. So what you want to do is to brush that hand from the wrist going towards the knuckles, right? So wrist towards the knuckles. That way. Do that 15 times, 10 to 15 times, all right? Try this. Don't, just like what we did with the elbow, try opening up your hand and fingers without brushing. It will be very difficult. It will be very, very tight, okay? So do this 10 to 15 times and then try to open your hand, okay? So when you open your hand, you're going to dig into your fingers, right? But the key is the thumb. Remember this. The key is the thumb. So this thumb will be like that, more than likely, or like this, okay? It's very difficult to open this. So the key is the thumb. So try to pry the thumb, but very gently, because it will rebound. It will bounce back to closing, okay? That's part of your stroke, right? So you gently open the thumb like that, using your good hand, the thumb and index finger and the middle finger. Okay, so gently stretch it out towards extension. Okay, then the rest of your fingers, meaning your ring and your little finger, will try to get into your fingers, your stroke hand fingers. Okay, then you just let the thumb go because you have extended it, and then by the fingertips, just the fingertips, don't go inside the hand because that will trigger another reflex to close your hand, okay? So you're just using the fingertips, you stretch your fingers out, okay? So I am doing it this way so you can see, but you can on your own, please try to do this on the table so it's not hard on your elbow, okay? So try and stretch your hand and fingers to open up, okay? Very gently. This will take some time, so very gently, all right? Just like that. Then, if you can turn your arm towards the table, do that. And then just gently stretch your fingers to straighten out, okay? So again, the thumb is the key. If your hand is curled up like that, open that thumb with your good hand, index and your middle finger. Extend it towards extension. Your little finger and your middle finger goes towards the stroke fingers. All right, it will be very hard again. Very tight. So be gentle, take your time, be patient. All right, and bring it towards the table. All right, and if it's still curled up like that, you just stretch it, coming from the forearm towards the wrist, gently stretching that hand and fingers out. Okay, you can also use your table to do this. Okay, so you go this way, right? You open up the thumb, you have extended it already. Okay, then you are trying to extend your stroke fingers. Try to bring it towards the end of that table if you're able to. If your elbow and your shoulder is already relaxed and you're able to move it, bring it towards the edge of the table. All right, so it will still be curled up, right? Then you just lean away from it to stretch your fingers towards extension or towards being straight. Okay, just pull back and lean away. All right, and that's how you stretch and open up your hand. After that, you should be able to maintain that stretch a little bit longer. Okay, so let's try to do that as well. We need to stretch it some more. So if you are able to straighten it out, gently come up. Okay, come up and straighten up the entire arm. So your elbow might still be tight, right? So it'll be like this. And again, your fingers might curl up again. So just come up from your chair, bring your hand back a little bit, and then support your stroke elbow with your good hand and bring it to a straight position like this. Again, be gentle because this is very, very tight to start with. All right? And once you're able to manage that way, again, with your stroke hand, just stretch the entire hand towards extension. Okay? From the elbow towards the forearm, gentle, gentle, gentle. And then going towards your fingers. Once you are there, hold this position for about a minute and try to put weight on that entire arm. All right? And this is your last position to stretch your entire arm for the day. Hold this for a minute or so, as long as you are able to tolerate it. Now, if your legs are getting tired, just go ahead and sit down very gently, okay? And again, your hand and fingers might start to curl up again, but don't worry, you already know what to do. Again, start from your elbow, or start from the shoulder, elbow, wrist, and hand, okay? All right, so that is how you open up your hand and your fingers if it's curled up like this. I hope I was able to help you in this video in opening up your stroke hand. And if you find this video helpful, give it a thumbs up, share it, and click on the subscribe button, okay? So, again, just a reminder, consistency is the key and never give up. Until next time, paalam.